Hello, National Liaison Officers. My name is Susan Gorry. I'm a general dentist from New Zealand and a member of the Membership Liaison and Support Committee of the FDI. The Membership Liaison and Support Committee would like to present to you this video as an example of FDI Policy Statement implementation. FDI develops and shares policies, standards, and information related to all aspects of oral health care around the world. It does this through the publication of FDI policy statements, which are declarations that lay out the current thinking on various issues related to oral health policies, and the dental profession. They can be found on the Policy Statements page of the FDI website. In order to access the policy statements, you need to go to Resources drop-down menu of the FDI website and select Policy Statements section. Then you need to scroll down the page. You will see the policy statements listed in alphabetical order. You may also look for a policy statement using filters by keyword, standing committee chair, year of adoption, or revision. The Membership Liaison and Support Committee has created a special policy statement toolkit for FDI National Dental Associations to use as a reference. This FDI Policy Statement Toolkit shows national dental associations how to advocate and promote oral health to various stakeholders, government bodies, civil society, third-party funders, etc., with the support of the FDI policy statements. In order to access the FDI Policy Statement Toolkit, you need to go to the Resources drop-down menu of the FDI website and select the Policy Statements section. You will find the Policy Toolkit in PDF format in English, Spanish and French on the right-hand side of the web page. The FDI has policy statements that can be adapted to your situation. The New Zealand Dental Association chose to address one issue, reducing the consumption of sugar-sweetened beverages, and used the policy statement Dietary Free Sugars and Dental Caries and the Sugar and Dental Caries Toolkit for this purpose. The policy statement sets the relationship between free sugars and caries as its principle and advocates for the reduction of free sugars consumption as a central element of an integrated food policy. The toolkit provides the advocacy steps to be taken in order to achieve this goal. These were the steps followed by the New Zealand Dental Association. The New Zealand Dental Association chose to tackle the consumption of sugary drinks. After undertaking background research, the objectives were defined in a consensus statement on sugary drinks. This was endorsed by a number of health-related organisations. The advocacy campaign could then begin. This was aimed at central government, local government, the beverage industry, schools, and the public. The New Zealand Dental Association employed a spokesperson, Dr. Rob Beaglehole, who at that time was also the Principal Dental Officer of the Nelson Marlborough District Health Board. His role, along with members of the New Zealand Dental Association Executive, was to advocate for the reduction in the consumption of sugar-sweetened beverages. Sugar-sweetened beverages were the focus at this stage, as they are the major source of sugar in children's diets in New Zealand and provide no nutritional value. His lobbying involved the use of this and the following slides, among others. In New Zealand, the effects of dental caries is one of the most common reasons for children's hospital admissions. In 2016, 29,000 New Zealand children had one or multiple teeth removed due to infection. New Zealand adults consume approximately 29 teaspoons of sugar per day, and children consume approximately 25 teaspoons. Sugar-sweetened beverages are the highest contributor to total sugar intake for children and the second highest contributor for adults. New Zealanders' intake of free sugars far exceeds the recommended 6 and 3 teaspoons for adults and children accordingly. Sugary drinks have no nutritional value. They contribute empty calories and replace healthier beverage options. New Zealand has the third highest adult obesity rate in the OECD and increasing, and the third highest rate for type 2 diabetes. In New Zealand, 2/3 of adults and 1/3 of children are overweight or obese. In 2014, Rob was influential with the Nelson Marlborough District Health Board in banning sugary drinks from hospital premises. Now all 23 DHBs around the country have followed suit. Lobbying occurred at local government level and at retail outlets. Our advocacy has involved targeting leaders, making use of strong facts with clear and concise messages, speaking out at any opportunity, using the media, but it's always small steps and you have to be patient. The New Zealand Dental Association continues to advocate on all these issues. As well as trying to reduce the consumption of sugary drinks, the New Zealand Dental Association is promoting water as the go-to drink. Dentists, stepping up to help their local schools become water only, won the FDI Smile Award in 2018. Resources have been developed by the New Zealand Dental Association to assist dentists in encouraging schools to become water only. And recommendations for a water only school help gain the support of parents, teachers and children. As well as encouraging schools to be water only, the New Zealand Dental Association runs a national Switch to Water campaign annually, enlisting the aid of a sports personality. To conclude, the New Zealand Dental Association continues to advocate for change. Our objectives were to limit the marketing and availability of sugar-sweetened beverages, promote a healthy diet, ensure transparent food labelling, and introduce a tax on sugar-rich foods and beverages. I'd like to congratulate the New Zealand Dental Association and Dr. Rob Beaglehole on the successful project. And thank you for listening.